In Guyana, as of yesterday, 30th of March 2020, we have moved from 8 to 12 confirmed cases and 1 probable case. Our deaths have moved from 1 to 2. Of the numbers above, the regional breakdown is as follows: 1 case in Region 3, 10 cases in Region 4, with 1 inconclusive, and 1 case in Region 6. Of the total confirmed cases, the number of imported cases is 4, and local transmission 8. The total number of persons who have been tested has moved from 46 to 52, with 12 positives, 39 negatives, and 1 probable case. The number of persons in institutional quarantine is now 43. Of the 11 persons in isolation, 1 is hospitalized in the COVID-19 ICU unit. As it pertains to regional capacity, we have used the PAHO model to determine the number of projected cases for Guyana, which stands at 1,400. Of that number, we will be preparing for 100 persons requiring ICU, 300 isolation beds across the country, and capacity for 730 beds for institutional quarantine. In an effort to contain and mitigate the further spread of this virus, the Ministry will be strengthening community and hospital surveillance, as well as the rapid response surveillance team. As of yesterday, calls to the COVID-19 hotline moved from 998 to 1,065. These calls were received from 7 of the 10 administrative regions. No calls were recorded from regions 1, 8, and 9. Members of the media, fellow Guyanese, I wish to clarify the issue surrounding the death of the patient in Region 3. This patient did not, and I repeat, did not contract the coronavirus disease, nor did he die from COVID-19, as is being alleged. His death was as a result of his underlying conditions. Hence, I'm making an appeal to those persons stigmatizing the family to desist from this practice and not indulge in fake news. We must empathize with the family for the loss of their loved one. As it relates to our citizens with medical conditions, I wish to focus on our cancer, HIV, tuberculosis, and sickle cell patients, who all fall into the category of the immunocompromised. The guidelines are the same for them, but they must take extra precautions. We are in the process of organizing alternative arrangements so that they are provided with their medications without putting themselves at additional risk. The regions are actively working on developing a system where all patients, especially those with chronic diseases and other specialty clinics, can be seen. At-risk groups would not need to come out, and the best mode to operate would be shared at a later date. There still remain some lingering doubts in the minds of our population concerning who should be tested. I wish to reiterate that the Ministry of Public Health continues to follow the testing guidelines provided by the World Health Organization, which are as follows. Any person with acute respiratory illness, fever, and at least 1 sign or symptom of respiratory disease, including, example, cough, shortness of breath, and a history of travel to a COVID-19 infected country during the 14 days prior to the onset of signs and symptoms, or those who came into contact with a COVID-19 infected person locally during the 14 days prior to the onset of signs and symptoms, or close contact with a confirmed or probable case of COVID-19 during the 14 days prior to the onset of signs and symptoms, or exposure to a facility where COVID-19 cases have been reported or taken care of during the 14 days prior to the onset of signs or symptoms, or patients with severe acute respiratory illness and that requires hospitalization in the absence of a diagnosis which explains the current signs and symptoms.